Welcome back to the Elevate Wellness Podcast, and we're thrilled to have you guys back with us today. We're going to discuss one of the more common questions that comes up quite often, and that is, how long do I need to wait before I start feeling the benefits and positive effects of my testosterone therapy? And, these benefits are kind of laid out over the course of time. The good news is that some of the more tangible benefits you may start feeling in a matter of as short as a couple of weeks. And then the other good news is that while some of the longer term effects and benefits start to kick in months to maybe even years down the road, you're still on the upswing. You're still benefiting from treatment on the upswing as you go. And some studies suggest that even as far as 36 months, things like bone mineral density, visceral fat loss, and muscle gain are still in the uptrend. So today we're going to discuss some of these things in the real world based on evidence from not only studies, but what we're hearing from patients. So welcome back. My name is Gil. We have Vivian with us.
Hello.
As always. And I'll let you start and speak a little bit because you're the one that does a majority of the actual patient consultations. So I do a lot of the research-based stuff behind the scenes. You do a lot more of the real-world conversations one-on-one with all these men who report back to you. So why don't you walk guys through a little bit about what is entailed when you start someone on treatment, when you see them back, what you usually hear or what they report as their initial benefit or lack of, and then how long until you see some of the other benefits.
So we always do blood work 2 months after they start, right? Everybody has an initial set of labs, and then we do blood work 2 months later, and we speak to guys. And first thing I always ask is, how do you feel? Typically, patients start to notice a difference within 2 to 3 weeks as far as like energy, mood, sleep, libido, erections. Workouts are better, strength improves, joint pain goes away, brain fog improves. But again, I always tell guys, give this a good year. Give it 4 seasons. It takes a second to reverse hypertension. It takes a second to reverse prediabetes. It takes a second to really burn good visceral belly fat. That doesn't happen right away. We're in this Amazon society where everybody wants everything right now, and it's just not how this works. I always say this, you get what you give. I mean, yesterday when you and I were listening to a lab review with one of the girls we're training, the guy's labs were gorgeous. 5'9", 300 pounds. He's like, I'm still tired. I don't feel good. I'm like, bro, my job's done here. You need to do something. I can't help you anymore. The medication's only going to go so far. If you're not eating right, if you're gaining weight like he was, if your sleep is trash, if your diet's trash, if you're not exercising, maybe you should stop.
It's funny. You just, you gave me a little epiphany. You said Amazon results.
Yeah.
So what popped into my head is a term I need to coin now. When somebody is impatient and they want instant result, I'm going to call it TRT prime. It's like overnight. I start today.
Yeah.
I want my results tomorrow. It's TRT prime.
It's not.
You know what's funny? It's a lot of the benefits that people start for is they expect to look different in the mirror. They expect to get stronger. They expect less belly fat, more muscle, etc. All of those anatomical changes that occur in the body are the ones that actually come on the tail end after you've done work for X amount of time. I always tell guys, testosterone doesn't work. It allows you to work better. It gives you the drive, the motivation, the oomph that you need to actually get out and do things, hit the gym, start to diet, right? Because nothing motivates and drives results better than seeing results. So as you start to feel it and see a little bit of result, it helps you to push forward. The first benefits that I think people report are more of the psychosomatic results. It's not necessarily what happens to your body, it's what happens to your mind, right? It's the drive, it's the brain fog that's being lifted, it's the mental clarity, it's that overall sense of well-being, right? Talk a little bit about when most guys report that and why you find that some guys maybe start to feel that a little sooner, some guys have the delay, and some guys maybe don't even feel that benefit at all.
Right. Well, I'd say the greater majority of guys experience really good results within 2 months, right? Because they're also trying to do the work. The guys that aren't experiencing any result of that at all typically have untreated sleep apnea. I can throw the lion's share of testosterone at you. If you have sleep apnea that's untreated, it's not going to help. You're still going to have brain fog. You're still going to have afternoon tiredness. You're still going to have ED, low libido, poor energy, poor mood, and they'll say things to me like, well, my wife says I don't snore. My partner says I don't snore. That doesn't mean you don't have sleep apnea. Snoring doesn't mean you do have it. you need to go get a sleep study. That's the gold standard for diagnoses. And if you have it and you refuse to treat it, well, don't expect good results.
Yeah. Let's say out of 10 guys that start treatment, because remember, most of the demographic that come in symptomatic where we assess, most of the demographic tends to be slightly older and presumably, not always, but presumably have some level of comorbidities, maybe a little overweight, because remember, a lot of the symptoms they're complaining of have a lot of differentials, such as obesity and diabetes and hypertension and any other metabolic factors that lead them to feel how they're feeling. It's not always just low testosterone. So the demographic we're getting are older and generally sick in one shape or form, not always. So because of that demographic, let's say out of every 10 patients you see, how many would you say may suffer from sleep apnea?
I'd say 4 out of those 10
So
guys.
40%. So that's a significant amount. So what are some of the things that guys can look for, or some of the things that you can look at someone visibly and say he's more than likely to suffer from sleep apnea?
Well, elevated red blood cells. On the doses of testosterone that we're putting men on and the conservative frequency of injection, you should not have high red blood cells with what I do at all, unless you're grossly under consuming water, free water, just straight up water or, liquids in your daily routine. So that is the first indicator to me. If you got if you have hemoglobin and hematocrit 19 and 56, 57, you have sleep apnea.
Right.
You need to fix it.
I mean, dehydration doesn't elevate hemoglobin and it doesn't elevate RBCs. It elevates hematocrit transiently in the short term. Because generally, if you look at the standard, for example, when you go to donate blood, they check just hemoglobin and they multiply by 3. So the rule of multiplying hemoglobin by 3 is how you get an accurate reading of hematocrit, or at least where it should be. If your hematocrit is 3, 4, 5 points above the multiple of 3, that's dehydration. That deficit there is dehydration. So what would you say as far as physical appearance? Like what I'm looking for is, for example, obesity. Guys who are obese, they have a larger chest. They may sleep on their back, so they have a harder time breathing. Guys with larger necks tend to have a harder time breathing. Guys with any sort of breathing disorders, deviated septums, emphysema, COPD, smokers, anyone that's got obstruction, chronic bronchitis, anyone that's got any sort of a breathing obstruction, more likely to have sleep apnea. So it's not, it's no wonder that you get this demographic of older guys, sicker guys, more obese guys, guys who are not as healthy, guys who don't lead the best lifestyle are going to have more likelihood of sleep apnea. So you say 4 out of 10, it's a big demographic. I think another thing that we find that's quite common that is really a shock to a lot of these guys is the amount of type 2 diabetes and pre-diabetes or insulin resistance in general, right? Talk a little bit about the prevalence of insulin resistance in older men, how it relates to low testosterone, and just how many guys we find that are shocked to hear it for the first time.
I'd say 75% of the guys that I do lab reviews on have prediabetes and have no idea. They're like, wait a minute, what do you mean I have prediabetes? I'm like, A1C is elevated. It could be from a lot of different things, and they'll say, well, diabetes isn't in my family. I'm like, look, I'm just reading the numbers off a page. I'm here to give you information. What you choose to do with that is on you. But yeah, a lot of prediabetes. It's insulin resistance. It's poor diet. We're sedentary. Everyone's doom scrolling on their phone constantly. Nobody wants to put in steps. Nobody wants to lift weights. Nobody wants to eat well. You're going to have prediabetes.
Explain for those that don't truly understand, because everyone hears the word diabetes. I don't think the general public really understands just how bad of a disease it is, or truly what is it? Like pathologically, what is occurring in the body? What is diabetes? What is type 2? What is insulin resistance?
So insulin resistance, you got to think about insulin as a key that's unlocking part of the cell to let sugar from your blood go into the cell so that it lowers your blood sugar. When insulin resistance happens, those keys don't work anymore. So yes, you could have good pancreatic function, but if the insulin isn't helping to open up those doors to let the cells accept glucose, doesn't matter. So that's one. And then 2, if you're not lifting weights and eating protein, your body's just not metabolically sound. And that's another thing. Well, guys will say, well, I eat protein and I lift. I'm like, yeah, but like what you think lifting is and correct lifting is may not be that, as evidenced by the fact that you're not getting results and you're saying that you're putting in the work. So then there might be some more of an assessment on their part to try and get to the bottom of why they're not having good results. And then, we can even go into the whole cholesterol and high, like I feel like every guy I talk to now has prediabetes, high cholesterol, a little bit of high blood sugar, a little bit of high blood pressure, belly fat, and they're just so puzzled.
So most insulin receptors live in muscle tissue. So naturally, the more muscle you have, the more insulin sensitive you are. So the best way to reverse insulin resistance, whether it's prediabetes or type 2, is to build more muscle. And again, testosterone being an anabolic hormone helps with building more muscle. So TRT certainly helps to reverse type 2 diabetes. And as we age, our utilization of glucose starts to deteriorate as your metabolism starts to slow down. And this is directly related to a decline in testosterone. So testosterone therapy can help to delay or completely reverse the risk of diabetes. And a lot of guys don't get just how nasty of a disease it is. People are losing fingers and toes. Erectile dysfunction is a big one. That's usually what brings them in. People are losing their eyesight.
Kidneys.
Kidneys.
The number one reason why I put people on dialysis was diabetes. Diabetes and chronic NSAID use. So if you're popping a lot of Advil and Motrin, you're chewing up your kidneys pretty good.
I remember many years ago when a friend of mine back in New York, who's a nephrologist, I spoke to his PA, and she said most of our patients are diabetic. And I said, well, shouldn't they be with an endo? She says, they come to us because of kidney failure.
It's too late. Yeah, if you're showing up in a kidney doctor's office and you have diabetes, you're looking to get on the machine. And the problem with getting on dialysis, if you have diabetes, is your mortality rate increases by 20% every year. So if you get on the machine, you got about 5 years. Guys that make it further than that, or people that make it further than that, are outliers or unicorns. I think we had one gentleman, he's still alive. He was on dialysis when I left, 12 years. That's rare.
So America leads the entire civilized world in healthcare spending every single year, per capita, per person. And yet we lead the world in diabetes. That is a scary thought. We're actually spending the most amount of money per individual on healthcare, but we're leading in diabetes. So the problem is that we're spending it on health care. We're not spending it on health promotion.
That doesn't make money.
Right. So what we do is prophylactic health promotion. We focus on education and we focus on lifestyle that prevents disease rather than just band-aiding a disease forever. And I think that is the biggest difference. Unfortunately, insurance-based medicine isn't geared to prevent. It is geared to treat.
It's a business. They want to make money.
Your insurance company will never pay for you to not get sick. They will simply pay for you to not die when you are sick. And unfortunately, that just means load you up with more medication. So one of the reasons that we do this, and one of the reasons that we spend a lot of time consulting with patients and that we are a concierge-based practice, is because we feel it's really important to spend time on education so that a patient has a better understanding of what's going on in their life, and they can prevent disease and they can reverse existing disease.
Why don't we talk about, I always say, what came first, the chicken or the egg? What came first, low cholesterol, or high cholesterol or high testosterone?
Okay.
Sorry, high cholesterol or low testosterone. What came first?
If that's a riddle for me, then I would say it depends on the patient. But I would say that the same level of neglect that leads to one generally leads to the other. Because low testosterone is inevitable with time. Once you become primary and you're have testicular failure, and that's usually age-related unless it's acute trauma, the problem is that we're seeing prevalence of testicular failure in much younger men, and we're seeing pituitary failure in much younger men, which is directly contributed to lifestyle, drugs, poor sleep, stress, alcohol abuse, etc.
Screen time.
Screen time as well, which impedes their sleep, and the sleep is really where your luteinizing hormone levels peak. So a combination of technology, which makes us lazy, coupled with the fact that technology is in your face all day, again, it all breaks down back to lifestyle. Lifestyle leads to poor health choices. And now you got Uber Eats and DoorDash. And I mean, nobody's even going to the supermarket anymore. Nobody's cooking. It's like, hey, get me a pizza, get me a burger. I'm tired. I need dinner. Let me get a taco. It's like daily, right? So, yeah, I mean, and then you're talking about high cholesterol. It's a lifestyle choice.
But I'm interested to see now that more and more men are getting their testosterone checked sooner. Because a lot of guys will come in and they'll say, well, I went for my yearly and my cholesterol was a little high and I was starting to feel a certain way and my doctor refused to check my testosterone, but he said I needed a statin. And that's when things really went bad. and I really started feeling bad. And now I check my testosterone and it's super low. I'd be interested to see in the future, now that more and more men are checking testosterone sooner, if testosterone starts to drop and then does cholesterol start to go up in response to that. And talk a little about, like, I remember when I first started working for you and you were like, cholesterol and testosterone molecularly are almost the same.
Well, they're both steroids.
Right.
They both contain the molecular structure of 4 carbon rings containing of 3 hexagons and 1 pentagon. That is consistent with all steroid hormones, regardless of what their end result is. The base makeup is a sterile group, essentially, which is where steroid, that's where it comes from. It's a sterile group, which is 4 carbon rings. So they all share it in common, and they just have different tails that do different things.
But I remember you telling me, you were like, cholesterol needs to synthesize testosterone. Testosterone, you need to synthesize cholesterol, and vice versa. When one drops, the other one.
So cholesterol is the raw ingredient for, it's the king steroid, right, that is the raw ingredient for all steroids. And all steroids start their life as cholesterol and are synthesized from it. Testosterone being anabolic and increasing the positive nitric oxide balance helps to improve the lifestyle factors that help to maintain metabolic health and prevent dyslipidemia or high cholesterol. So yeah, one feeds into the other. So once you start on this train of statins and you're killing your cholesterol, your natural testosterone levels are going to decrease as well.
It'll be, I'm interested to see that and to see where that's going to go now that more and more people are checking testosterone. I almost hope that once men reach like 18 or 20, it's just added in a regular blood panel, just like a CBC and a cholesterol.
Here's the problem. You made an interesting point. You said a lot more men are getting their testosterone checked, which is true. But here's the problem. Testosterone has been declining every decade, consistently. As it declines and more men go get checked, what happens is the norm or the average keeps coming back lower and lower and lower, and then they keep moving the goalpost on the lab. So they keep accepting that the new low is the new norm. And that is why the bottom number keeps dropping, because more men test at that number. So they say, well, if 3 million men tested at 300, then 300 is now normal. And that's the problem. That's the problem. So again, we don't treat to normalize, we treat to optimize. And that is, again, the difference between a prophylactic concierge approach to health promotion versus a chase the disease process using insurance after the damage is done. So when guys say, well, I have insurance, why do I need to pay out of pocket? There's your difference. The difference is, do you want to work with a true expert who understands how to prevent disease progression or disease onset and actually educate you in the process? Or do you want to work with someone that's going to band-aid a problem that's already in the works, then it's going to snowball out of control sooner than later, and they're probably not trained on doing this correctly because, frankly, insurance pays them minimum wage. Okay, in this field, insurance-based providers are minimum wage providers. They're getting what Medicare sets as a rate for a visit. They need to see 50 guys a day. They don't have the time or fortitude to actually go out and stay on the cutting-edge research the way we do because, frankly, we're paid well to do it. Okay, so you decide, do you want the best coach on your team, or do you want to grab a kid off the high school schoolyard, or do you want Phil Jackson coaching you to a championship? That's really what you're paying for, essentially.
That's so true. Guys are like, why can't I just run it through my insurance? It only costs me $30. I'm like, well, first of all, your doctor's going to give you 1 shot a week or 1 shot every other week, if at all.
And when things go sideways, they're not going to have a clue what to do.
They're going to call you back when you have bad blood work. You think they're going to call you back if you have erectile dysfunction because your 200 milligrams every other week has just destroyed your life? No, they don't care. They're going to say, stop. Didn't work for you. Stop taking it.
And when your insulin spikes, because there's no education on how to reverse insulin resistance, and you're basically crushing SHBG, because we know insulin is the biggest antagonist of SHBG. As SHBG goes down, what's going to happen is total T moves in tandem. Your total T is going to keep coming down. And you're going to say, what's going on? I'm on the same dose for last year. My T used to be 1,100 and now it's 650. I haven't changed anything. You know what they're going to do? They're going to increase your dose. And when they increase your dose, guess what happens to your SHBG? It shoots down as well. And now you're exacerbating a problem. They have no idea what they're doing. They're probably not even looking at SHBG, let alone understand how it works. And now you're progressing. So when we get guys, they usually have single-digit SHBGs. Their dose is 200 milligrams a week or more. Their frequency is wrong. They have metabolic syndromes, high insulin, and it's a train wreck, but it's always the same picture. And I always understand why it happened, because they keep chasing the number that keeps dropping because they keep doing it wrong.
Oh, and they keep increasing the dose, which only makes it worse.
They don't
So
understand.
much worse. Oh my God.
They don't understand that the reason their total T dropped is because SHBG went down due to poor frequency, wrong dose, and high insulin. They just don't get it. And no matter how many videos we make on this topic, they keep asking, well, I don't understand. What makes you different? Everything makes us different. We actually understand what we're doing. That's the diff. It's sad. I wish everyone out there did this correctly. I truly do. I invite competition. I want every provider in America to do this right. I truly do. I'll retire a happy man knowing that I have left a good legacy of proper treatment for all men in America. And unfortunately, I'm here fighting an uphill battle trying to convince other providers and, more importantly, the patients themselves that it's being done incorrectly. But, you know, we're fortunate to have thousands of men who trust us with their health, who actually understand that we do it right and the results speak for themselves. I just wish more people actually took advantage of it.
Or you have these guys that called it like, well, Reddit said.
Dr. Reddit, Dr. Google, absolutely.
I put my lab results into Chat GPT. You're not dosing me right.
The blind leading the blind, as I call it. Yeah, yeah. Let's regurgitate what I've read on Reddit and then put that on Facebook. And now 5,000 people on Facebook read my post because I'm assertive. And all of a sudden I have this commanding discipline to just dictate. And now everyone calls and says, hey, this guy looks halfway decent. And he said he does X, Y, Z. Why am I not doing what he does? Don't even get me started. These social media platforms are a blessing in one hand because it allows us to get a message out. They're a curse in the other because anyone with a phone and a microphone can get in there and just regurgitate erroneous information.
Let's talk about the newest ick. Should we microdose daily? I read online to microdose daily. It's driving me nuts.
I'm officially banning the word microdose, effective immediately.
So
Yeah. I don't know. What does microdose actually mean?
I have no idea.
The word micro is subjective. Okay, microdose, what does that mean? Is there like a number or threshold by which anything above it is not micro and anything below it is micro? What the heck is a microdose? What does it even mean? Some guy apparently made up this microdosing and now everyone talks about it. When I ask a patient, well, what does microdose mean? They don't even know.
No.
Because I sure as hell don't know what it means. It's just frustrating. Again, this is the regurgitation of nonsense that people read on the internet, on whatever sites they're on, and they just like to just kind of fit in. It's just a sheep herd mentality. Hey, enough people said it, so it must be true.
Or it must work, so maybe I should try it. My first answer is always, well, do you really want to stab yourself every day? You don't have to. If you want to, have at it. I don't live with you. You want to stab yourself every day, go for it.
Daily dosing has a place and time for a very select few individuals for a very relatively short term over the course of their lifespan of treatment. And it's generally done for super low SHBG with the hopes of regulating it to a level where they no longer need to do it. Now, if you're a fanatic guy that says, I like to dose daily, I like to do it daily, great. Again, please don't use the term microdose. It means nothing. But if you like to daily dose your injections, communicate it with us, and we will be on board with you if it's adherable. There's usually no reason or benefit to it if you have normal SHBG, but if you find it beneficial, by all means. Most men do not need that, and most men will not benefit from it.
And I always tell them, I'm like, if you have high SHBG, you're not going to feel,
it's just not, it's going to be indifferent. There's no difference between twice a week or daily if your SHBG is 70. Correct. There's no difference. You're still steady. So you can, it's just not going to make a difference one way or the other. It's just more invasive.
It's my new ick.
And more, yeah, I hate the term microdose. I do. Every quarter, every 6 months, there comes a trend that everyone gets on board with and starts to talk about, and it kind of hits all these groups at the same time, and everyone calls with the same nonsense. Part of our job, it is what it is. Just have to
I remember when I first started, if you told somebody to daily dose, the groans. Oh, it was like I was asking them to go and, go donate an organ. And now everybody's like, can I microdose daily? I'm like, oh, please don't.
Evolution.
Please don't.
Evolution of trends is what it is. Yeah. So, well, this is informative. I think there's good information for people. Is there anything you want to add today before we close out?
Good.
Okay. Well, hopefully you guys find some value in the information we aim to provide. If you feel that you need more information, our website, elevatewellnessgroup.com, has a slew of information in the knowledge-based section, literally over a decade of videos that we've spent time, or I've spent time making, on almost every topic related to men's health, specifically hormones, nutrition, cognition, sexual function, etc. And we're happy to bring this content to you every week. If you'd like to learn more about working with us, again, elevatewellnessgroup.com. You could drop your contact information in there. Our office will reach out to you within one business day and explain to you the process of how we work. We do treat nationwide via telemedicine. So if you live in the United States, you have access to a telephone and an email, we can treat you directly over the phone right from your home. So thank you again for watching. We look forward to seeing you on the next episode.